And the other one? It doesn't look like Revlimid, you know? It doesn't look like from the Revlimid.
She's had a rash before all over your body, right?
Right. That's why I was
But
like,
it's not like
this
that.
Is not like that.
Yeah.
No, not at all.
Okay.
It does. Does it even look like a rash?
It looks a little bit like a rash, but I mean, I think we could watch it. I'm not sure what it is.
It's getting better.
And I don't think I'm not sure it's related to the medications, to be honest with you. So you're saying
thank
it's getting better? Okay.
I don't think so either.
Okay. So I don't know, I mean, it depends. I don't want your neuropathy to get really bad, but you have the option. You could do either or. And I think that your genetics were good, so you have the option. You could do whatever you wanted.
Okay, tell me what the outcome is that you are thinking of, your knowledge, after 5 more cycles. What does that look like to you?
Hopefully you have a complete remission. That's what I would like, or something very close to a complete remission. I don't have the numbers today, but all your numbers have been getting better. And now, they were almost normal, these numbers. So I was going to do a bone marrow biopsy after cycle 4 if you're going to stem cell collection. And then we can look at the marrow and see what it looks like. But that's the outcome. But you could have maybe similar outcome with a transplant. Now, with the transplant, you don't have to take any more Velcade. So this doesn't get worse. That's the issue with you.
That's why
because
I
some people
understand.
don't
That's
get
why
some people don't get the neuropathy.
Mhm.
Some people don't get the neuropathy. So
Okay.
the other advantage if you do the transplant is you could go on a trial for maintenance with other medications. The advantage of doing this is that you can, maybe do the transplant later. You don't have to do it now. And of course the transplant is, a procedure that has some risks. Really, most people do very well, so I'm not really scared that something is going to happen to you, but you could continue on this treatment and then do the panavinostat with the lenalidomide maintenance, which is also investigational. So there are goods and, pros and cons of everything.
I didn't get that one at all. What the last part of what you just said.
So the maintenance you do, in this trial, you do lenalidomide and panavinostat.
Are those
without the
medications?
Velcade.
So Revlimid. And
Those are the
panavinostat.
medications she's taking right now.
Oh, okay.
The same medication she's taking right now. Okay.
You're talking real fast.
I know, I am.
Okay. So, excuse me.
I know, it's okay. Are you okay? Okay. I cannot make a decision for you
I'm
because
asking you to.
I know. What do you want me to do?
Well, you
Explain.
started answering my question,
Okay,
but you said it like that.
I know. You want me to say it again? Are you gonna be okay?
Mhm.
You can.
This is a major decision.
I know, but yeah, you feel like it's a major decision, but I'm going to tell you, either way you're gonna be fine. It's not that major, to be completely honest with you, because you're gonna be fine either way. Listen, if I thought,
You got some tissue.
yeah, here, if I thought that you really had to do one over the other, I would tell you, but that is not the case. You can choose, so it is really your choice.
And that's the information, what you just said,
Yeah.
that I didn't ever have before.
Oh, okay.
Okay?
But I told you told me what is the outcome. The outcome is, I told you, I'm expecting the same thing to happen with either or.
Okay.
So you can choose. So you have choices. They're your choices. And I don't want to make the choice for you. Now, my concern is, with you, the neuropathy. I don't want to give you the neuropathy. The neuropathy gets worse with the stem cell collection. When you get the Neupogen, it gets worse.
When you get the what?
The Neupogen, these are injections to make the white cells go up. It can get worse. And then
And that's
we can,
if you have the stem cell.
well, but you have to have a stem cell collection regardless.
Okay, I was about to ask you that. So you're talking about collection.
Just doing the collection.
No
Now,
cause.
I'm talking, if you don't do the transplant, the neuropathy can get worse just with the collection. And then if you don't do any more Velcade because you do the transplant, then it gets better. But the Velcade, continued Velcade, makes your neuropathy worse. My only concern with you is you have, in my opinion, just talking to you every month, you have had problems with this treatment. You have had a lot of side effects.
Okay.
And the neuropathy is getting worse. So that for me is a big concern.
Okay.
That is my concern. I don't care what you do, because I think you will do well whatever you do. To me, it doesn't matter what you do. I just want you to make the decision, because I don't want to make this decision for you. But you're probably going to do really well whatever you do. Whatever you do. So if you don't feel like doing the melphalan right now or doing the transplant right now or going to the hospital, we can delay it, but then maybe we will have to do dose reductions in the Velcade. We'll have to give you less dose or something like that. And we can figure that out. But your disease is not bad. You don't have any
My what's not bad?
your
Disease.
disease is not bad. And we have talked about this before, that your disease is not bad. So you can do whatever you want. And you're probably going to do really, really well regardless. So it's very good. You have options.
I
If you
understand.
if you had really bad disease, I would be saying other different things. I would be saying, don't do the transplant, do the collection, then we'll do maintenance with Velcade, and I would be saying something completely different. But your disease is very good.
Okay.
Lori, your disease is very good.
Mhm.
So you have choices.
I understand. I appreciate that. I appreciate you slowing
It's
down
very good.
and taking your time to explain it.
It's very good. So you have choices. So, what you have to think about is your decision is about, can you do another 5 cycles of what you are doing in similar doses, or do you want to do the transplant, which is 1 month or so, and get over with it, and then go on to a maintenance, maybe with an antibody and the Revlimid, with newer medications and the Revlimid. That's the decision you have to make. Can I do this for another 5 cycles, or do I not want to do this anymore because it makes me tired, it gives me neuropathy, it's horrible, all that stuff. If you think, okay, no, this is not too bad, I actually can have a normal life, I'll just do the collection, keep doing this, and then do the maintenance on the trial, which is with the panavinostat and the Revlimid. That's the maintenance on the trial. And I usually don't give the steroids because I don't like long-term steroids, especially she doesn't have high-risk disease. Your disease is good. So
I remember you said that.
yeah, so you have many choices. So, and you could ask any myeloma doctor, they'll tell you the same thing. You just have choices, and unfortunately, I think the best person to know what is going on is you.
Oh, sure.
In my opinion, if you feel like you're doing okay with this treatment, we can just do the stem cell collection and continue, and then if your neuropathy gets worse, we can reduce the dose, and we can do 1 milligram per meter square instead of 1.3, that's what you're getting now. So we can do that if your neuropathy gets worse. So that's as good as an option as doing the transplant.
Okay.
To me, they're very similar. And it really depends on what you feel about the transplant. Some people don't want to do the transplant, and they come and they say they want, and some people, this, and some people come and say they want the transplant. And in your case, you don't know what to do. So those, I don't know. What thoughts do you have about this? What are your thoughts?
Well, I want to make sure I completely understand the stem cell transplant, or a total of 9 cycles.
8.
Total of 8.
8, because
Oh,
you're going to
8,
start
but-
4 today.
Yeah, I
So
got
it's
you. Okay.
4,
So a total
and
of
then
8.
4 more. 8,
Mhm.
yeah.
Which would include
The same thing that
this-
you're getting.
Which would include the, stem cell collection.
Yes.
Okay, and or proceed forward with that, and we can possibly reduce if we have
Right.
problems with the neuropathy continue.
Right.
Okay.
Right. Because I really don't want, some people, it's very bad, they can't walk, I don't want that for you, obviously.
For
Because
sure.
you have good risk disease, and why would you live, many more years with neuropathy? You don't have to do that.
Right.
So,
Well, and I don't know enough about neuropathy to know. Like right now, my fingers feels like someone's poking them. At its worst, it starts bothering me up to here, But that's towards the end of my cycle on like the 3rd and 4th treatment. Okay.
So when you feel like you cannot do things that you don't want to do, or if it starts to be painful, those are bad signs.
More pain. So I would experience more pain. And
You already have pain?
Well, when it feels like it's all the way up in here,
Okay.
It's like I told my a good friend the other day. One of the weirdest things is like getting in a bathtub. Your body's used to being at a certain temperature,
Yeah.
but you put your
You wanna
feet and your
go?
hands
No.
in.
Yeah. Oh,
You put your feet and your hands in, and it feels like they're on fire
right.
because it's hot against the hot. That's
Right.
what it feels like. But it can get a lot worse than that, is what you're saying. And and it doesn't have the sense of not being able to control.
Right.
Okay, So I'm nowhere near that, right?